Here at Healing Hands in Nebraska, we are amazingly excited to be the first center in all of Nebraska to offer a new approach to trigger finger problems. Close your hand, you'll make a fist like this, and then when you open your hand, one of the fingers will get stuck and it won't pop out, okay? And so what'll happen is you have to kind of pull it up and then it pops. Well, in patients who have trigger fingers, what happens is this part of the sheath starts to irritate the tendon, okay? It's typically because you're using your hand too much, repeated motion. And so what happens is the tendon starts to fray. And when the tendon starts to fray, it swells up because the body's trying to heal it. Well, that swollen tendon then gets stuck in the pulley. And then when you close your hand, the tendon comes down into here. And so that swollen part ends up down here. Now, the reason it's a concern is because not only does it make it difficult for you to use your hand when your finger does this all the time, but it's also painful. The most common one is using ibuprofen or naproxen or some other non-steroidal anti-inflammatory drug, along with minimizing the use of your hands. Now, for some people, that might be a really good option. And for a lot of people, that's all it takes. If, for instance, you're a seamstress, or you're a carpenter, or a plumber, or a mechanic, and you use your hands a lot, minimizing the activity with the hands isn't all that practical. One of the ways in which we can treat that is to do a steroid injection right in the area of the tendon where it's swollen, to try to decrease that swelling, decrease the inflammation, so that the finger will work properly. And for some patients, that's a really good option. And we do that here in our office under ultrasound guidance so that we can be more precise. But what if you've had that injection done and it wasn't as helpful as you wanted it to be? The standard surgical treatment is to make an incision in the palm of the hand, okay, right about here, and that incision is usually about this long, okay, and then you lift up all the tissue, you find that pulley, and then you open up the pulley so that the tendon has more room and so that it's not being irritated anymore, okay? Now, one of the challenges with that is that a lot of patients say that the recovery from that procedure can be a little bit difficult because you've made an incision in the palm of the hand where you're doing a lot of work, and that incision also involves stitches, and a lot of patients find the stitches really irritating. There's also activity restrictions associated with that. Our practice is the first one in all of Nebraska and for a few hundred miles around to offer the UltraGuide TFR procedure using a device made by Sonics. We can make an incision that's a little bit bigger than the end of my pen, okay, under local anesthesia, okay? We make that incision, we slide the device right under the pulley, right in here after you're numbed up using ultrasound guidance. We open up that pulley, and then we put a Band-Aid on, and that's it. The entire procedure takes less than 5 minutes. If you're really interested, come see us here at Papillion Family Hospital on the 19th of February. We're going to be talking about carpal tunnel surgery with ultrasound guidance and trigger finger surgery with ultrasound guidance. You don't have to worry about the risks associated with being put to sleep. We can make it easy, we can make it affordable, we can make it quick, we can make it simple, and you can get great results.